Hey everyone, it's Lee Edwards here from The Move Doctor, and I'm bringing you my 5 favourite exercises that I like to use in the early stages of dealing with knee pain, part 1. Let's talk about our knees. The knees are something that I get asked about a lot, whether it's my knees are sore sitting down or my knees are sore when I'm standing up. What can I do to make them better? How can I make them stronger? So in this part 1 video, we're going to look at just getting some movement back into the joint, getting some contraction and a blood flow around that joint, and we're also going to start to look above and below the knee as well. Now the reason we do that is, if you look at the knee, we just look and think it just bends and extends, and that's it. But we also need to take into consideration above and below the joint. So how the ankle's moving, how the shin's moving, and also how the hip's moving can have a big say on the quality of movement around that knee joint. And this is where the early stage of movement comes in. The first exercise that we're going to look at is called a quad set. So we're just looking to get some contraction of the joint, looking to get the quad muscles contracting, get a little bit of blood flow, and also encourage a little bit of extension through that knee joint, which can sometimes be lost when dealing with pain. So we're going to be sitting with our legs straight out in front of us, and we're going to look to contract the quad muscle here. So we're just going to squeeze that muscle, hold that for 5 seconds, and relax. Now what I want you to do with this is, as we squeeze, drive the back of the knee downwards into the surface that you're sitting on. So we're going to contract and push that knee down into the bed in this instance, hold and relax. Now we're going to do that for 10 reps, and we're going to repeat on both sides. If, to make it a little bit easier, we want a little bit more support, we can use a rolled up towel, a cushion, even a tennis ball, something that we can put behind the ball that's nice and soft, but it's going to give us that little bit of resistance to push against, to really drive that knee into the surface. So same again, we place that at the back of the knee, same thing, tense the quad, squeeze and hold. Now in this position, what we're going to be encouraging is a little bit more extension through that joint as well, as when we squeeze, my foot will also lift, extending that joint a little bit more. Make sure we're maintaining that pressure, and then relax. Exercise number 2 is a straight leg raise. Now in this straight leg raise, what we're looking to do, we're looking to start incorporating the hip as well, as the rectus femoris muscle of that quad group is the only one that crosses the hip, so also acts as a hip flexor and acts in movements from the hip. But it attaches and onto the quadricep tendon, which is just above the knee itself. So we need to get that involved when looking to improve on that knee pain. So again, we're going to have our legs out in front of us. We can lean back slightly on this one, wherever you're comfortable. If you need to go a little bit further, that's absolutely fine. Again, we're going to look to contract that quad. So we hold that squeeze, then we're going to look to raise as high as we can and slowly lower back down. Release that contraction, squeeze again, lift that leg up, and then slowly back down. Looking for a little bit of extra range each time. You're going to feel that through the quad, and it may feel a little bit crampy. That's okay as long as it's tolerable and not too painful, providing you discomfort where you think you need to stop. That cramping will likely be the body and the brain trying to process a new position, and muscles in the way that don't get used that often as we look to build that strength in the area. Again, we're going to go for 10 reps and repeat on both sides. The third exercise that we're going to look at are tibial rotations, looking to free up that shin bone and the tibia to grease that joint and get some more movement through. Now this is often something that can be underlooked and not really worked upon that much, but it can be really important in getting some space open for movement and allow for better contraction from there. So what we're going to do, we're going to sit down, we're going to put our heel on the floor and lift our toes up. We're going to make sure the heel is pushing into that surface so we're not sliding away. We're going to be pushing down to create a nice little bit of contraction. Now we're going to hold our knee still, and we're just going to look to rotate the foot as far as we can outwards, and then the same on the inside. Really pushing that heel down to create the resistance. Rotate out. As you rotate out, you'll feel the lateral side and the lateral side of the hamstring start to kick in, and as you come in, you'll feel that medial side. And we're just going to look to do this for 10 to 12 reps. 1 rep is a complete out and then in, and we're going to look to free up some space, repeat it both sides to complement the other movements that we're doing and really start to open out that joint. Exercise number 4 are bridges, and we can do this a couple of different ways. The first variation, we're going to lie on our back, feet flat on the floor, and we're going to look to drive our feet into the floor and slowly lift our hips towards the ceiling. A couple of seconds hold at the top and slowly control that back down. So pushing through the feet, lifting the hips to the ceiling, and then slowly lowering back down. For a little bit of an extra challenge on those bridges, I really like to use an object to squeeze in between the legs on each rep, just to get a little bit of inner thigh and adductor engagement, which are really important to stabilise the hip and also help in cases of knee pain. I'm using a yoga block here, but you could use a cushion, a ball, as long as it's big enough to put in between the legs to maintain a good squeeze. So back into that position, object in between the legs, as close to the knees as you can. Again, maintain the squeeze the whole time. Feet are driving down and we're lifting the hips up towards the ceiling, maintain the squeeze, and then slowly back down. We're going to repeat that for 10 reps. For exercise number 5, we're going to start to work the outside of our hip, and most notably those abductor muscles such as the TFL. Now these are really important, again, for stabilising the pelvis, but also help with stabilising the knee, as that TFL joins to the IT band, which then runs down the leg and attaches just on the outside of the tibia. Now what we're going to do is lie on our side, legs straight. Now the top leg is going to be our working leg, so we're going to rotate this in slightly, and as we lift, instead of coming straight up towards the ceiling, we're going to come back slightly as we lift. Now that little shift backwards just engages those muscles a little bit more, so we're going to rotate in, lift as high as you can, hold for a couple of seconds, and then slowly back down. We're going to go for 10 reps again, and slowly back down. If we want to add a little bit more of a challenge to those raises, we can start to use a band. Now this is a tough band, so we'll see how well we get on, but we're going to place that band around the ankles, and again, side lying position. Now that band is going to provide us with resistance that we're going to have to work against to perform that movement. So again, rotate in, drive back, nice resistance, really feel that building up in there, and slowly back down. Again, repeat for 10 reps, or just get the number of reps out that you feel where the quality of movement is still good and we can get good resistance and contraction on that. So thank you for watching. I hope you enjoyed the video and that you've been able to find some insight into how to start to work the knees and also find a little bit of relief from the issues that you've been having. If you did like this video, please like it and subscribe to the channel for more. Keep your eyes peeled for part 2 coming soon.